Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have also interest in cancer prevention and treatment and public health. In this video, we are going to look at early pregnancy tests, early pregnancy signs, and what to do next. Is it just a late period, or is it the beginning of a new life? A tiny change inside you could mean the beginning of a new life, and this could change your life forever. What are some of the silent whispers that you could be pregnant? One, before the bump, your body sends quiet signals. Know how to learn them and listen. Every woman experiences early pregnancy different, but there are signs that gently whisper that something new is happening in your body. And knowing to recognize these signs and symptoms could be a way of your learning that you are pregnant or not, and taking the necessary steps. So this should be a source of hope, not anxiety, but the beginning of a new life which would be coming. So what are some of the early signs of a pregnancy? Of course, the first sign would be missed periods. If you have been having persistently regular periods, there are some women who have periods who fail, and so if your period is delayed, give it time up to a week or so. Then tender swollen breast would be a sign of pregnancy. Fatigue, you feel exhausted all the times, and then morning nausea even without vomiting, and then you become oversensitive to smells. Frequent urination due to pressure on the urinary bladder. You may start having mood swings which you did not experience. Light spotting or mild cramping. Sometimes you may have the implantation bleeding, which can happen about a week or so after the operation. Then food aversions or cravings. You tend to like some foods and then have a dislike for some others. Then dizziness or headaches. You may have general body fatigue. You may have unusual taste in your mouth. You may have sensitivity to smells, and also you may have aversions to smells and the likes. So what do you do if you suspect you could be pregnant? You need not to panic. You need to plan. So what do you do to know? Take a reliable pregnancy test. This could be the first confirmation of whether you are pregnant or not. That lies in the hormone that drive pregnancy, makes the pregnancy test to turn positive. Then start a prenatal vitamin like folic acid. Folic acid is very important for expectant mothers because it helps in the development of the baby's brain and also the spinal cord of the baby, and it prevents what we call the neurotube defect. Children who have poor folate access get the nervous system do not close up appropriately as it should. So it is important that you start taking folic acid as early as possible. Then the moment you know that you are pregnant, this would be the best time to book for your next antenatal clinic. Starting early helps you to prevent possible complications, and also helps you to start getting health education the earliest possible. Then it is important to eat healthy foods and also ensure that you hydrate well for better nutrition of your baby. So ensure that you are taking foods rich in iron like meat, liver, not green leafy vegetables, lentils that will help you build your iron stores for yourself and also for your baby that is starting to develop. Then there are things that you need to stop, like alcohol, tobacco, and also some medication. And if you're on prescribed medicines like drugs for pressure, drugs for epilepsy, then the moment you realize that you are pregnant, you should see your health provider the soonest that you can. So what do you eat and what do you avoid in early pregnancy? One, eat more of the leafy green vegetables, eat eggs, eat legumes, and also ensure that you are eating whole grains. The good thing with whole grains, they have a variety of nutrients that are required by your body to keep you healthy. Then eat iron-rich foods and also eat foods rich in proteins, and then eat adequate supplies and servings of fresh fruit, vegetables, and ensure adequate hydration with water. Then avoid raw fish because it could affect your baby. Avoid unpasteurized dairy. Avoid excess caffeine. Avoid smoking. Avoid alcohol, and also avoid recreational drugs. So some of the myths about early pregnancy that can be misleading include: you can't exercise while pregnant, papaya causes a miscarriage, it is only safe to tell others after 3 months. Well, if you are expectant, it is always good to let others know so that you can get help. And it's also good to get in touch with your health provider or your obstetrician so that you can get the necessary help and the necessary supplements so that you start on time. Stay informed and avoid these myths because they delay care. So, what are some of the warning signs that you should look for that could tell you that there is danger to your pregnancy? If you have heavy bleeding, if you have pain on one side, it could signal that your pregnancy is not located in the right place. If you have dizziness or fainting, if you have temperatures of more than 38 degrees centigrade, if you lose the pregnancy symptoms that we have talked about, then know something could be going wrong. This could mean an ectopic pregnancy or an early miscarriage, and early action saves life. Remember, an ectopic pregnancy, as I've said in one of my previous videos, is a life-threatening condition and need to be sorted out immediately. So be aware of some of these danger signs. So you are not alone. Becoming a mother begins with listening to your body, to your heart, and also getting the right advice. So do you have questions? Let's all walk through them together and seek help at the earliest possible. So what should you do? Pay early attention to the early signs, confirm with a test, begin prenatal care as early as possible, and this would mean the moment you realize that you are pregnant, eat well, listen to your body. If it needs rest, ensure adequate rest, avoid stress, and if you get stressed for any reason, know how to cope up with stress. In one of the videos, I have talked about how to practice mindfulness and be able to overcome stress and reach out for support. Every life begins with an awareness. So be gentle and be yourself. So it is important that you know that the journey of motherhood begins long before the bump shows, and it begins with awareness, courage, and care. Follow Dr. Joshua Derito for trusted guidance on pregnancy, family health, and self-care. So subscribe, share, and give your comments on this video, and also follow us on our other health channels.